Dentistry is changing. It's not just about teeth anymore. Not that many years ago, dentistry was mainly focused on finding cavities to fill or teeth to remove. There was not an understanding that there is a relationship between oral health and systemic health. We might have suspected it, but we didn't have any evidence that really proved it. Now we know that there is a strong relationship. In fact, you may have read about some of it in some of the current magazines. Specifically, for example, we know that there's a relationship between gum disease and heart disease, cardiovascular disease. We know that women who have of childbearing age who have severe gum disease are at risk for low birth weight babies. There's some evidence now that certain forms of dementia may progress more rapidly in people who have severe periodontal disease. And finally, we also know that pneumonia is one of the leading causes of death in senior citizens, and now the relationship between gum disease and pneumonia is very solid. We also know that the shape of the mouth can have a lot to do with certain things, such as sleep breathing disorders. People have large tongues or they have a high vaulted palate or at higher risk for sleep breathing disorders. And the inability to chew due to lost teeth or the bite that isn't correct, aside from affecting some of the joys of living, such as chewing, also can reduce lifespan. Some studies have indicated that it can reduce the lifespan by about 7 years. Here at Expressions Dental, we are really focused on the relationship between oral health and systemic health. We're not just about teeth anymore. One of the things that we want to do is take a comprehensive approach to the examination, the diagnosis, and the treatment planning for our patients. Unfortunately, there's a lot of misconception and misinformation about what comprehensive dentistry truly is. Some people think that it's replacing all of the silver fillings in the teeth with white fillings, or crowning all of the teeth in the mouth. Nothing could be further from the truth. That is not what comprehensive dentistry is. Comprehensive dentistry is simply taking a look at all of the things that can cause problems in the mouth. In other words, we're looking for causes. We're not just looking for effects. Dentistry historically has spent a lot of time looking for effects and unfortunately has missed the causes. What we want to do is we want to identify the causes so that we can come up with a plan for our patients that's going to minimize the problems and the risks and the costs of the future. There are a lot of different causes. Some of it can be habit, some of it can be genetic, some of it can be related to simply home care that needs help. There's a lot of systemic diseases that can cause problems in the mouth. And so what we do is we take a look at what I call the 4 food groups. We take a look at gum tissue, which is periodontal. We take a look at structure, which is how strong are the teeth. We take a look at function, which is can you chew and function the way you want to be able to. And finally, we take a look at aesthetics. Do you look the way you want to look? Once we have this information, we review it, we take a look and connect it with your medical history, and we come up with a comprehensive treatment plan. The comprehensive treatment plan is designed very simply to help prevent more problems in the future. In other words, it's addressing the risks and the causes rather than just focusing on the effects. In over 30 years of practice, I've yet to meet somebody who wants to spend any more time in the dental chair or be drilled on any more than necessary. So what's in it for you with the comprehensive approach? Very simple. What we want to do is give you all the information that you need to have to make sound decisions about your oral health. It's helping you come up with a strategy to reduce the risk of more dental problems in the future and therefore reduce the cost and the time involved. I'm absolutely convinced that the most cost-effective approach for dentistry is the comprehensive approach. The most expensive is the piecemeal approach. If you feel that this information is a benefit and you would like more information or this approach is for you, please don't hesitate to contact us at Expressions Dental.